A year ago, a new virus rattled our nerves and raised alarms across the country. Now vaccines are giving us all hope. My colleague Charles Benson is live outside the Medical College of Wisconsin with a look at where we've been and where we're headed.
Shannon, nearly 1 out of 10 people in Wisconsin contracted COVID-19, and there's been a lot of questions about this virus, even here at the Medical College of Wisconsin. When Wisconsin needed a steady voice during the COVID crisis, many found it in a man steeped in science and medicine.
We're dealing with a 100-year pandemic unlike anything that we've seen since the Spanish flu pandemic of 1918.
Dr. John Raymond leads the Medical College of Wisconsin and its 5,800 faculty and staff. As a practicing kidney disease specialist, he also helped us understand the nuances of COVID-19.
COVID-19 is a disease that attacks blood vessels, the brain, the nervous system, and other organs as well as the lungs. So it's not simply a respiratory virus.
Things we've learned and are still learning.
As many as a third of patients who have survived COVID-19 have some form of chronic symptoms or disabilities from their infections, and we're still learning a lot about that.
What worried you? What kept you up at night?
I think the most worrisome part from the healthcare perspective was whether we would have such a huge surge of cases that we would overwhelm the capacity of our health systems to take care of patients with COVID and then people that have other diseases.
A year ago, coronavirus cases were rising and businesses were closing. The uncertainty added to the fear. Milwaukee even added a temporary healthcare facility at State Fair Park to handle a potential crush of COVID patients. But for the most part, Wisconsin managed the pandemic during the spring and summer with case counts below the national average. All of that changed in the fall when Wisconsin went from averaging 3,000 cases in mid-October to 7,000 cases in mid-November.
We dodged a bullet here in Wisconsin. In November, we were the epicenter of COVID-19 in the U.S., and the capacity of our healthcare systems was very taxed. And we were just so fortunate that we reached the tipping point but didn't tip over, unlike some of the other states.
But that doesn't mean the virus wasn't taking a toll. The daily death numbers were overwhelming for all of us and frontline healthcare workers living it every day.
But burnout has always been a problem and a growing problem with healthcare professionals. Estimated that 30 to 50% of physicians and nurses feel burnt out and unhappy with the profession. That's only been added to by the stress and the strain of COVID-19.
Dr. Raymond says the college added support systems to help stressed out workers. Despite all the obstacles and hardships in 2020, Dr. Raymond is optimistic that vaccines will get us past the pandemic. Are you confident we can reach herd immunity given the reluctance for some to get the vaccine?
Well, I'm confident that we're sending a very consistent and clear message that the vaccines are safe and effective and that they are our shot to getting on the other side of COVID-19.
Now, scientists put herd immunity at about 80% of people fully vaccinated or with antibodies. So take a look at the numbers. Wisconsin right now at 13% fully vaccinated. That's a tad better than the nation at 12%. But look at Alaska at 19% fully vaccinated. But keep in mind, they allow anyone 16 and older to get the shot. And Shannon, starting Monday, anyone 16 or older in Wisconsin with pre-existing conditions will be able to get the shot. Shannon?